Hi, everyone. Welcome. We're so happy to have you all here. Thank you so much for joining us. My name is Erin McDaniel. I'm with Vios in our Chicago office. And I'm really here just to help keep the conversation going and help our speakers manage any questions that you all have. So I really appreciate you taking some time to join us this evening. We're so happy to have you. And I'm going to let each one of our speakers, each one of our lovely nurses here, introduce themselves in more depth. But just as a quick aside, I have Kristen Loftus from our St. Louis region. I have Morgan Eminger from our Chicago region. And I have Molly Nogalski. Sorry.
No biggie. That's okay.
I should have practiced that more. My apologies. Joining us from our Milwaukee region. And so I am going to turn things over and let each of them introduce themselves in a little bit more detail. And then we'll go one round of introductions, and then we'll start in on the medication demonstrations. So Morgan, if you maybe want to kick us off with your introduction.
Hi everybody, I'm Morgan. I'm one of the nurses from Chicago. Today I have my mocktail. It is a mocktail mimosa. It has Welch's sparkling grape juice and some orange juice, so going kind of fruity today. And my fun fact is all of my extended family lives in Germany.
Awesome. Thank you. I didn't know.
You're welcome. Yeah.
Fantastic. Well, Kristen, let's kick things over to you. Tell us a little bit about yourself.
All right. I am Kristen, and I work primarily in the St. Louis region. Typically stay at the Swansea office, but I do go to all the offices, so you may see me there. Today, I have my berry mocktail. It's a berry mix with some sparkling water in there and some ice. And the fun fact about me is we are Disney obsessed in our house. So even my son's room is a replica of Andy's room. So we are completely Disney obsessed.
So cute. That's awesome. Thank you. And Molly, tell us a little bit more about you.
Hello, I'm Molly, and I've been working at Vios Milwaukee for 3 years from when it started. I've been a fertility nurse for 18 years, about 18 years. So I've been doing it for a little bit. My mocktail, actually my manager got me this beautiful glass. It says "Because Patience," and I love it. I use it often. And my mocktail consists of mint and cucumber and lime and club soda and a little bit of cranberry juice, and it's really good. And let's see, I guess a fun fact would be I did IVF once upon a time, and I've done a lot of these medications that we're going to talk about very soon. So I have some experience not only teaching, but having them injecting myself, so I can kind of speak from a patient's point of view.
Thank you, Molly. Very good. So to give all of our attendees just a quick lay of the land, we're going to turn things over to Morgan here next, and she's going to run us through Lupron, Follistim, and Gonal-F. We'll take a quick break at that point and get all of our questions out about either of those 2 medications or 3 medications. And then Kristen will pick back up for us on Menopur, Cetrotide, and Ganirelix. Same thing, we'll pause for questions. And then Molly will take us home with the HCG trigger and the progesterone and oil. And again, we'll have collective questions at the end. So you can ask questions anytime through the chat box or through the Q&A. And when we pause in between each of those speakers, we'll be glad to take your question live if you want to raise your hand and you can speak. So with that, Morgan, I'm going to turn things over for you, and you can run us through Lupron, Follistim, and Gonal-F.
All right, so first we're going to start with Lupron. Some things for the injection: you'll need some gauze, alcohol swabs, your syringes here with the orange cap, and then the Lupron vial itself. So to begin with the Lupron, if it's a new vial, you're going to have to pop the little lid off the top. Even if it is a new vial, we always recommend taking an alcohol swab and cleaning the top. I'm going to open my first swab here, do a nice rub, and then let it dry. The drying is what actually kills the bacteria. Then I'm going to prep my syringes, again, the ones with the orange cap. The Lupron can be used, we primarily use it for two different ways. We use it to suppress the body, so while prepping for a transfer, or you may even use it during IVF stimulation process, or we can use it as a trigger shot. So depending on what you're using it for, the amount of units you'll need can vary. So what you're gonna do to prep your syringe here, once I get it open, you're gonna draw back with air the amount of units you'll be using. So let's say I'm going to be using it for a trigger and I will be using 40 units. I'm gonna draw it back, I'm not sure if you guys can tell, to the 40 unit mark. I'm gonna take the cap off, be careful of the needle, you don't wanna poke yourself. I'm gonna inject the air into the vial and then flip upside down. I'm gonna draw out the Lupron again to the 40 unit mark. You wanna make sure you're not getting any air bubbles. If you do get air bubbles, you can kind of flick them to the top, inject the air out, and then redraw back. So then once you take it out, again, be careful with the needle. If you do need to recap, I recommend keeping the top on the table, taking your hand out of the way, sliding it in so you don't poke yourself again. I'm gonna use my fake little injecting skin here. Take another alcohol swab. So this is a subcutaneous injection. It goes into your fatty tissue. We recommend going about 1 inch away from the belly button. This is my pretend stomach here. You want to stay parallel to the belly button or the quadrant below. You don't really want to go above. You'll clean your site. Again, let it dry. You'll take your syringe with the needle. You'll pinch your skin. You're going to want to go in at a 45-degree angle once the alcohol is dry. And then just inject. We'll take a gauze pad, remove out. You can put a little pressure down. If you do leave a little bit of Lupron out, it's okay. That can tend to happen sometimes. You'll leave the cap on the table. You'll recap it. Then you can take this and dispose of it in your sharp specs. So that's Lupron. Again, dosing may change for a trigger, or if you're using it to suppress or prevent ovulation. For any other reason, you'd inject the same way. So that is Lupron. I'm going to move on to Follistim or Gonal-F. These are both versions of FSH. First, I have my Gonal-F pen. This comes pre-filled. And so what you'll do, it also comes with the needles separate. So what we like to do first, your units may vary patient to patient, dependent on your protocol. You might be using this for IVF. Sometimes patients use it during an IUI or timed intercourse cycle. The cap comes off. There's no needle on the end. Again, that's separate. And then you'll twist the end here to the amount of units that you are prescribed. So let's say we're taking 150 units. You want to make sure the dial says 150. Again, you're going to take an alcohol swab and you're going to clean the cap where the needle will be attaching. You're going to let it dry, and then you're going to take off the little covering on the edge of the plastic needle covering, and you're going to twist it on. So it's nice and tight. There is a second plastic covering underneath, so you can keep that one on. You can just put the second plastic one off to the side. Again, you're gonna prep your skin. This is also a subcutaneous injection, so you're gonna do it really similarly to the Lupron. You're gonna clean off your abdomen area. Again, 1 inch away from the belly button into the fatty tissue. You want to stay belly button parallel or lower. You don't want to go too high or too low as well, kind of by your pant line. You don't want to go below the pant line. So then again, be careful of the needle. We'll take the second covering off. Gauze ready. Pinch the skin at a 45-degree angle. You will go in, press the top of the pen, inject down till it goes all the way down. Take your gauze, pull out. And again, if you feel more comfortable, you can place this down. I wouldn't recommend touching it so you don't poke yourself. Easier said than done. And then put the needle back on the cap. You can screw it right off. The needle is now protected in the cap. You can put it in your shorts container, recap the pen, and you want to store your Gonal-F as well as Follistim in the fridge. So Follistim is the same thing as Gonal-F. It comes in this little green case here. The only difference in setting up the pen is the cartridge comes not pre-installed for you. You have to insert the cartridge yourself. So don't throw away the pen. You're going to need to keep it to reuse it because you will have to change out the cartridges. You can take this off. It's empty in the inside here. You can see that there's like the blue spring in the inside. You can unscrew it, insert the cartridge face down so the clear part's face up. You'll just screw the Follistim on. Want to make sure the arrow and the yellow line up. You'll attach your needle, same thing. Inject the exact same way, works the same way as Gonal-F. The only difference is you have to load the pen itself. All right, that is Lupron and Follistim and Gonal-F. Anybody have any questions regarding these medications off the bat?
Thanks, Morgan. And again, just a reminder for questions, you can pop it into the chat function at the bottom of your screen. Same with the Q&A function at the bottom of your screen. Or if you prefer to chat, you can raise your hand, and that feature will be there again at the bottom of the screen, or on the side you can raise your hand, and we're glad to kind of give you the mic. But if there aren't any questions about those, Morgan, you did a great job. Thanks for being so detailed and helpful with that placement as well. So thank you. So with that, Kristen, we'll turn things over for you for the Menopur, Cetrotide, and Ganirelix.
Right. So the first one we have is Menopur. It will come in a little vial. So whenever you get your Menopur, it typically, unless you're buying single vials, will come in a big box. I don't have the big box with me to show you, but if you get a big box, there are 5 individual vials in each box of Menopur. So whenever you do IVF, it's really good to always keep track of how many days worth, because this Menopur can definitely change throughout your stimulation cycle. So whenever you start to count, if you have, you're using 1 vial and you have 2 boxes, then you have 10 days worth of medication. So I really suggest keeping a close eye on that, just so you know how much you have left. So Menopur is probably one of the things I get most questions about, just because you have to mix it yourself. So there's a couple different ways to mix this medication. Every Menopur comes with its own little individual saline. So I don't know if you guys can see that, maybe. So pop off your top, just like Morgan was saying earlier. You're going to clean this off with an alcohol swab. So the difference between different things you can do with this is you can use a syringe, and we can draw up the saline with the syringe, or Menopur has these little cool Q caps that come with them. I prefer to use the Q caps, but not everybody wants to. But I'll show you first with Q caps. So sorry, I'm trying to keep this in. So this is the Q cap. You're going to peel off the back of this, and then you can kind of see it has this sharp little spike that's going to go down into your saline. So what I would recommend is to just put it on with this. You can hear that click, and it's tight on there, won't come off. So if your syringe has a needle on it already and you want to use the Q cap, which is needleless, then just twist off that needle and you won't need it. So draw up how much air you're going to need for the mils you're going to use. So with Menopur, you can use 1 to 2 mils. I recommend using 1 mil. If it burns a little bit, then you can always bump it up to that 2 mils. So draw up 1 mil of air, and you're going to screw it onto here. So it just attaches really nicely on here. Turn it over, oh, actually inject the air, and then turn it over. And then once you get that, you can still use this same Q cap that's on here to put into your Menopur powder vial. So you just kind of twist off, pull up. Actually, it'll probably be easier with my needle on here. It's gonna make a liar out of me. There it goes. All right, then spike in that Menopur powdered vial, inject. So you do not want to shake this Menopur. When you inject in, it mostly should dissolve all this powder, but if not, just slightly give it just a little bit of a swirl, not very much at all. When you're done and it's fully mixed, just draw it back into your syringe. So let's say that you are going to do 2 vials of Menopur. So if your dose was 150 of Menopur, you're going to need another powder vial. No need to draw up another mil of the solution or, give yourself the shot. You're going to take what you just drew up into another powder vial. And I think this is probably the most confusing thing until you see it. So pretend that this is just another powder vial. I'm going to inject this directly into that powder vial. So, kind of just gently swirl it around, draw that back up, and now we would have 2. So 150. If your dose is even higher than that, the same goes for that. This would be your 3rd or 4th, still with that same 1 mil that we started with. So then when you're ready to inject, you should have some other size needles. This is a 27 gauge 1/2 inch needle. Open this up and then put your Menopur on top of that. And then if you have bubbles, now is a great time to, get those out. Make sure you're not injecting any air into your skin. So here's my little belly fat. So just like all the other injections that we just talked about, it's going to go into your subcutaneous fat, which is just that layer below your skin. You're going to go about 1 inch from your belly button, squeeze that, and then inject, just like you did with the other drugs. Menopur can kind of burn a little bit, so I suggest injecting that very slowly. Sometimes we can kind of see a little reaction with our skin whenever we give Menopur. It could turn red just for a little while. Doesn't necessarily mean you're allergic to it, just has that localized reaction, and that's completely normal and completely okay. So Menopur, push that one really slow. Your skin will love you for it. All right, that is Menopur. Oh, and then if you wanted to use needles, I should say without this Q cap, you would do the same thing. The needle that comes on the syringe, you would just drop the 1 mil, inject that into the vial. But these Q caps make it so nice and easy that I really like to use the Q caps. All right, so the next one is another fun mixing medication is Cetrotide. So ganirelix and Cetrotide are what we're going to use in your stimulation cycle to help prevent ovulation. So we want to grow those follicles nice and big, but we don't want to ovulate. So these are medications we use for that. So this one, Cetrotide, goes in the fridge. So if your nurse ever says, do you have Cetrotide or do you have ganirelix? Yours is in the fridge, then we know you have Cetrotide. So let me get this out. Whenever you get it out, it is in a sealed little package. Go ahead and open it up. And then what you'll see is you have a little syringe that has saline in it. You have your powder vial. And then you have 2 separate needles, which is important. One is going to be for mixing and one's going to be for injecting. So it'll even say on here which ones to use. So This is the 27 gauge, and that's the one we're going to use to inject. So this bigger one, which is the orange, it's like a golden orangey color, that one's going to be used to mix. So take off your little cap to your saline here. Then these little needles have this little twist off. Go ahead and twist that off. Stick it down onto your syringe. Be very careful because these are really big needles that we're mixing with. And then you're going to pop off that top of the powder and then stick it down in there. And then inject. And as you see, as I injected that, most of that did start to dissolve. But if it needs just a tiny little swirl, definitely swirl that around. Don't shake this, you know, nothing like that. So once that's dissolved, I'm going to draw it up back into here. All right. And then sometimes there might be just a tiny little bit of solution that you can't get out, and that's okay. As long as most of this is in here, that's okay. We're talking like little tiny drops. Those are perfectly fine. Then recap this really big needle that you definitely don't want to inject with. Take that off. If there's any air in here, go ahead and get that out. And then uncap your injection needle. That's going to go into your skin. Put that on top. And then just like we did with the other injections, this is subcutaneous, goes in that belly fat. So from the belly button, going to go directly in and inject that. Now, this one shouldn't burn too bad, honestly, but I do recommend each night you're going to inject on different sides. So if you do the right side on Monday, then do the left side on Tuesday, just so it gives that area just a little bit of a break. All right, the next one is Ganirelix. So Ganirelix comes in this blue box. It does not go in the refrigerator. And this one is very easy to prepare because it's already prepared for you. Take it out of its little, it'll be sealed, a sealed container. And you can see it'll already be pre-filled for you. So they've done all the work for you. All you'll have to do is take off this little rubber cap and inject. And I bet you guessed, just like the other ones, it's going to go in your belly fat, an inch from that belly button. And you're going to go directly in, just like all the others, and inject. I don't usually hear that this one burns too much either, but within any injection, if it starts to burn, just push it slower, and that could definitely help. But that is how you give all those medications.
Perfect, Kristen. Thank you.
You're welcome.
Any questions that anyone has about any of those? All right. Well, thank you again, Kristen, with such good detail. I think you've probably answered anyone that they had coming along. So that's awesome. Thank you. So now, Molly, we'll turn things over for you for the HCG trigger and progesterone in oil.
Okay.
Everybody's favorite.
Yes, definitely. Okay, so I'm going to review the trigger shot, which this injection, so both the trigger shot, which would be called Pregnal or Novaril, there's a few different brands, sometimes even generic HCG can be dispensed from the pharmacy, and usually it's the specialty pharmacy that we would order it from. This is going to be used when the follicles are ready and mature, typically around 18, 19, 20 millimeters. And usually we are using this all for IVF. So this is a box of Pregnal. And you could see right there that it has, each box will have a powder and solution. It is not refrigerated either. So when you get it, you could just keep it in a safe place. You want to make sure you have this medication. It is a very important medication that will time out everything for when we want the eggs to be ready inside the follicles, so they are ready for the egg retrieval. So definitely when you're looking at your medications, you want to make sure you have the HCG or Pregnal injection. Okay, so you would take out It comes with solution, which typically is about 10 milliliters of solution, so it's a lot of solution. And then you have your separate powder, and it's 10,000 units of powder, and it's just the white powder that's on the bottom, and you're gonna have to mix it. So you wanna use a flat surface to put those on. And then what you would have typically called in for you or ordered would be, we actually ordered 2 3-milliliter syringes with either a pink needle, which is an 18 gauge, which is a pretty big needle. I always say never poke with the pink because it is really just for mixing. It's a big needle. It makes it easier to mix and draw up the solution and inject into the powder. Sometimes separately, a mixing needle could be this gray 22 gauge 1.5 inch needle. It could also be used as a mixing needle or even an injecting needle because it is a bit smaller. They're all the same length to reach the muscle because this one is an intramuscular injection. I'm not going to show you my where I would put it right now. However, when you're in for one of the last ultrasounds and getting prepared for this, we will draw a circle on the area of your upper butt hip area that you're going to be injecting this. So there should be no worry about where you're going. We also have modules on EngageMD just to review all these injections that we're talking about. Okay, so back to the mixing needle, you'll either have a pink one or it could be gray. And then you're gonna open that up. And you need the solution first. Always be careful. You have alcohol, I have an alcohol swab, and you'll need a gauze pad or a Band-Aid potentially. I don't have those with me, but a little alcohol pad. You're gonna flip off the top of the solution. I'm gonna pretend here because this is not a demonstration vial and it's our little backup that we would typically have. So you would flip this off and alcohol that to clean it. The dose of this will be varied for everyone. Oftentimes we do use all of the powder for 10,000 units to be your dose. However, depending on anyone's situation, we could decide to tell you, and we would lay out very specific instructions when we give you that a couple days before the egg retrieval. Sometimes we only mix a little bit of solution into the powder, so maybe the dose would be 5,000 units that you would do, or even half of that. It all depends on the stimulation and your protocol that you're on. So we will give you those specific instructions. So get your syringe, take off the needle. You're gonna go into the solution. I'm gonna pretend here, and you're gonna draw up to whatever we will kind of lay out for you. Typically, it's gonna be 1 milliliter. It's never gonna be all of the solution. That would be way too much. So you draw it up to 1 milliliter. Now you can, if you wanna start off using that air of 1 milliliter, you can. Honestly, if you forget, it's all okay. You're still just it's gonna drop the same and you have plenty of solutions. So I'm not even worried about that. So if you wanted to be real specific, you could draw an air first and then tip it upside down and draw it back out. So you're just drawing back the 1 milliliter and then you take this out. You're gonna have a lot of solution left over. That's okay. Typically, you might wanna save it. Just in case we ever tell you that you might need to take an extra little dose the next day, but just save it in case for that reason. 1 milliliter solution, you've got powder here. So if we say the dose will be 10,000 units, we will lay it out for you that you're gonna inject 1 milliliter into all of the powder. So on a flat surface, you're gonna do this, take off the top alcohol, and inject that all in, tip it upside down, draw back out, and that'll come close to 1. Sometimes you lose a little bit of the powder, and so it might come back to like 0.9, so that's okay. And you draw it all back out. This should be pretty empty. There's a couple little slits here that you could see so you can get the last few drops out. And now this is empty. And now you need to change your needle. So 1 scoop, change your needle tip, twist that off, and then you can put on your injecting needle, which typically is going to be much smaller. You could use a 25 gauge, 1.5 inch, or which is blue in color typically, or you could put on that gray 22 gauge, and that would be okay also. So it doesn't matter. And they're all usually 1.5 inches. Screw that on nice and tight. Any like major air bubbles, you're gonna flick that. It's fairly thin solution, so you shouldn't have too many issues. And then you press it up to the top just a little bit, so maybe just a tiny drop you would see at the very tip top of the needle. And then sometimes you might be able to do this yourself if you're laying on a couch, making sure that you're not having a tight muscle. Sometimes bending up your knee would help, or typically your partner would help you do this injection. It's a little easier that way. You're gonna go straight in. I have my fake skin here. Alcohol the area. If you wanna, even if you're hesitant, you can use an ice cube to numb it up just a little bit, maybe 30 seconds, and then alcohol, clean it off. And then you're gonna go 90 degrees. Oftentimes we tell you with the opposite hand to either pinch that area of the circle or hold taut. Either way, this 1.5 inch needle is gonna make the muscle. So just make sure you kind of have a little bit of a grip. You're taking off your needle tip, and then you kind of can count to 3. And if we're getting real specific, there's a little bevel that should be, the sharp point is going down. You could try to have that going down. Either way, it's still gonna also work just fine. 1, 2, 3, you go straight in 90 degrees preferably. And then with the intramuscular injection, you always wanna make sure you're in the muscle and didn't accidentally hit a blood vessel. So you pull back just a pinch, meaning one of these little lines would be fine. You don't have to pull back a crazy amount, just a little bit, and then slowly inject in. You kind of can just go at your own pace. Hold it for a few seconds when you're all the way in, and then take it straight out. And then afterwards, you might want to take your palm and rub that area out just so it feels better. And you might be a little sore the next day, but that's common. And then you just want to scoop up your needle tip, and you should they should dispense a sharps container, so you would put all of these larger needles and all the needles in the sharps container. So that is the trigger shot. And then progesterone and oil. You don't have to mix it. It already comes as is. The dose is typically 50 milligrams per milliliter, and it comes in just a single dose box. You will usually use the progesterone. It helps keep the uterine lining nice and thick. This is often for when someone's having a fresh transfer. We would definitely let you know when to start that, or in preparation before a frozen embryo transfer, we would definitely let you know. Once the lining looks nice and thick, then we let you know when to start it. But this is something that keeps on going. As if you're pregnant, cross your fingers, it all works, that you keep on taking this until 10 to 12 weeks of pregnancy, so there should be plenty of refills. So when we order this, you usually get about 4 to 6 boxes to last you at least to the pregnancy test, and then you have refills for it. So progesterone oil is typically made from sesame oil when we order it. Sometimes patients have known reactions and they've tried the sesame, so there's a special few other oils they can make it up in. Ethyl oleate would be another common oil that the specialty pharmacy would compound and dispense, but it's all the same dose. So we would let you know if you need to do 1 milliliter of this or 2 milliliters, and sometimes it starts off with a 2 milliliter dose and goes down to 1, all based on, you would know that because we lay it out in a calendar. You would also still use the pink 3 milliliter syringe, the same looking syringe and needle. It's always easier. The oil is thicker, so you would probably want to use a little bit of a thicker needle to pull back out. So alcohol at the top, And if your dose is 2 milliliters to start off, that's what you do. You want to make sure the needle is in the oil, not at the top in the air, of course, and pull back all the way to 2 milliliters. Sometimes if you want to pull back and push it back in, you reduce the air on the top so it's easier. And take that out. And you need to change your needle, scoop it. And then with the progesterone and oil, it is possible to use this little blue thinner needle and it's still the same length. However, it definitely is going to take a long time to put that in to the muscle. So we usually just recommend injecting with a 22 gauge, 1.5 inch needle, which is a little bit not as thin, so it goes easier. So you're going to want to open that up to try to keep, don't touch the top if at all possible. Screw that in nice and tight. And then just make sure there's not any major air bubbles. Itty bitty air bubbles are all okay in any of these medications. You flick it. And then also same area with your upper butt hip area that we can draw circles in. With the progesterone oil, it's thicker. So over time you can develop knots and lumps and bumps that are uncomfortable. We'll give you a few tips along the way. Typically even using heat, even if it's before, but especially after, really helps disperse the oil when you're injecting and afterwards. And taking your palm and really kind of rubbing the area afterwards helps. If someone wants to use ice, they could use it once again just for a little bit, but I wouldn't want to put an ice pack on your upper butt hip area because the whole muscle is going to be really cold and that progesterone oil would just lock into place, and you really wanted to, and it would just maybe hurt for a longer amount of time. So try not to do that. And then there is something I just wanted to mention that we call in if you want, we don't have to, but there's something called Sonera patches that are these patches that, once again, specialty pharmacies usually dispense. I don't know, sometimes the insurance may or may not cover them. They're a patch that you would want to put on 30 minutes before you're doing any of your intramuscular injections. You can use this for any injection. I want to say it's about $11 a patch if insurance does not cover it. Don't quote me on that. But it's a patch that you would place on your skin 30 minutes before, and it's actually like a lidocaine. So it numbs up the skin, and it's like a heating gel. So that helps with intramuscular injections for those who are just very scared to do those, and it helps the oil also afterwards. And it kind of lingers for a good amount of time after you're done with your injection, kind of numbing the area. So that's always optional. So that is it. Yes. Thanks.
Fantastic. Thank you, Molly. And thank you, everyone. Thank you, Morgan, Kristen, and Molly, all. That was great information and detail. We really appreciate it. So I know we will pause here. If anybody has questions about any of the intramuscular injections that Molly just walked through, or any of the medications we've talked about, any of the procedures that we've talked about, this is just an open forum now. If anyone has questions, again, you can pop them into the chat or the Q&A box at the bottom of your screen, or if you'd like to raise your hand in Zoom, we can kind of call on you and that way and just let you ask directly. Give you a minute to do that. And I know while we're waiting for any questions to come in, we did have one come in through our Instagram handle asking about the starting doses for Clomid versus Letrozole. And if one of you asked that question in particular, please clarify if I'm misunderstanding. But I think the question might be, what is sort of a general dose, and if there is a difference between the two medications. So I don't know if one of you would maybe want to tackle that.
I can answer real quick. So it'll just be based on, of course, what the doctor and you guys talk about at your follow-up appointment to go over that. But Clomid typically is going to be like taking either one tablet, which is 50 milligrams, or 2 tablets, which is 100 milligrams. And we would let you know when to start that, which would typically be starting from either on cycle day 3, day 4, or 5 at the latest. You would take 2 tablets together, doesn't matter AM or PM, for 5 days. And the similar but different medication for letrozole, if that's the planned medication. You would take letrozole. The doctor could usually decide on the dose of 5 milligrams. Maybe it could be 7.5 milligrams. So you would take either 2 pills together or 3 pills together. We usually don't go beyond that dose. And it would also be after like a baseline lab and ultrasound appointment, making sure everything looks okay. And we would have you started on day 3 or 4, maybe day 5. Day 6 kind of starting to get a little late started up. You would take those tablets at the same time for 5 days. And then typically if you're being monitored, you'd come back in around your mid-cycle scan, which would be day 10 or 11 for that.
Thank you.
Mhm.
All right. Well, with that, we will go ahead and wrap things up. And again, a huge thank you to our lovely Vios Fertility Institute nurses, Kristen from St. Louis, Morgan from Chicago, Molly from Milwaukee. We appreciate your time. We appreciate everyone who joined us this evening. Thank you very much. I hope you all enjoyed your mocktail and you feel a little bit more comfortable and informed about the medications. And of course, if you do have specific questions about your care, please contact your nurse and or your physician at Vios. And of course, you can most quickly reach everyone through the portal. So we'll encourage you to do that, and appreciate everybody spending some time again. I hope you all have a great night. So thanks so much, everyone. Bye.